This segment of Coast Life is sponsored by Beebe Healthcare.
Well, CoastLife, we always want to make sure that everybody in our community is in tip-top shape as best we can and taking care of themselves. And of course, we do that with our friends at Beebe Healthcare. We've got two very special guests joining us on the CoastLife couch today. We've got Chaplain Paula Waite and Dr. Katie Johnson with a palliative care physician. Now, if each of you could explain your roles a little bit within Beebe Healthcare and what you do and sort of your day-to-day and what that looks like.
I'm going to let Katie go first.
Sure. Hi, thank you so much for having us.
Of course.
I'm Dr. Katie Johnson. I'm the medical director of the palliative care program at Beebe. So day to day, clinically, we see patients with progressive chronic conditions, helping them meet their healthcare goals, wishes, values, psychosocial support through the end of their life.
And I am a staff chaplain, also the palliative staff chaplain. So I work with Dr. Katie, and we offer spiritual and emotional support to our patients. And obviously, we worry about people that are critically ill and how do we help them and how do we help their families.
Yeah, so you guys have quite a few events coming up. Talk to us a little bit about some of those events, and maybe even before we dive into that, some of the advanced care that you guys provide.
Sure. So advanced care planning is really an ongoing conversation with our patients and families. A lot of people think about it, oh, I have to make a document, but it's really more than a document. It's really diving into values, goals, what people really want for their life, and that really has to align with then what they want for their health care. So having those conversations over time with the patients and their families really dives down into how do we create ultimately a document that tells healthcare providers who they want to make their decisions, what decisions they really want made, and that helps us as providers then follow those wishes and give the patients and families what they need.
Yeah, that's huge. It feels very individualized.
Yes.
Absolutely. And we have taken this bull by the horns, as it were, to make sure that we are helping Sussex County as boldly as possible, offering educational opportunities so people can make informed discussion and informed decisions with their families.
Fantastic. And one of the ways that people can do that is by getting involved. Like we said, you guys have some events coming up. Let's dive into it.
Excellent. Well, we have National Healthcare Decision Day, which is coming up on April 16th. It was created back in 2008 by a healthcare attorney in Virginia, recognizing that we really needed to normalize the discussion around end of life and help people and help families have those discussions, because it's a difficult topic to have. Yeah. And so it was created, which is humorous, but Ben Franklin said the only thing certain in life is death and taxes. So that's why April 16th was picked, because it's right afterwards. And we're having 2 educational days. We're going to be at Lewis Library on the 16th. We'll have 3 educational sessions that day. And then we will also be at South Coastal Library on Friday the 17th, and we will have 2 presentations that day too, education. And people like Katie and myself, as well as the other palliative team members, will be there to help people fill out or to answer questions or to make appointments for further efforts.
Everybody gets kind of the dignity that they desire at end of life, the way that they want it, the way they want to be treated. And I think that really is just, again, it's a little bit of an uncomfortable conversation, but I think it is a really important one and one that you'd rather kind of get in front of.
Right. I mean, we plan for a lot of our life events.
Yes,
we plan for everything
true.
else. We plan for marriage, we plan for children, we plan for education, we plan for all of these things. And so, you know, a lot of people think planning for end of life, all we talk about is death. Actually, the most things that we talk about are how do you want to live?
Yeah.
That's really more how I frame
That's
the
great.
Conversation is how do you want your life to look?
Yeah.
And Beebe Healthcare is one of the participating members of the Conversation Project. We are actually the only healthcare institution in Delaware that's a participating member providing this ongoing education.
That's fantastic. So if people do want to attend these events, is this something that they need to purchase tickets for ahead of time? Can they show up? Do they need to register? How does attendance look?
We do recommend to registration, and there is a barcode that you can go on to either on our website or the flyer, which you guys are going to show.
We got that for you.
Exactly. And again, once people are there, we're going to be handing out documentation that they can take with us, resource guides that they can take with us, and we're also willing to meet with them afterwards to help.
That's awesome. So I think, you know, again, sort of thinking that end of life care, maybe you've got sort of a particular image of the person that would attend a conversation like this, but is this something that people of any age should really attend?
Yeah, great question. So everyone, I say over the age of 18 should really start having these conversations. That is when you're legally allowed to create these documents in general. And so it's not just for people that are older. I have my own advanced care planning documents. And so this is, you never know when anything can happen to you. Sudden events can happen all the time. So we encourage anyone, all ages.
Fantastic. Well, one more time, the times and places that people should be looking to show up before we let you guys go.
April 16th, Lewis Library. Presentations will be at 9, noon, and 3 o'clock. And then at the South Coastal Library, we will be there for a presentation at 9 and 10:30, but people again will stay after to help people fill things out.
And that's at South Coastal Library.
Exactly.
Fantastic. Well, ladies, thank you so much for being here today. Thank you so much for, sort of being at the forefront of this movement in a lot of ways and helping Sussex County as a community take care of each other.
Thank you.
Thank you.
Of course. We do have more Coast Life coming up. We've got a way that you can get involved in saving a beloved outdoor music venue. We'll get to that coming up.